Welcome to another deep dive. Today we have a medical mystery that's going to make you think twice about those DIY projects.
Oh, yeah, definitely.
You sent us this case study about a guy trapped under a collapsed wall out at his hunting cabin.
Yeah.
And it's pretty intense. So get this, he was trying to reinforce the wall when it came down on him.
The report says he was pinned from the waist down. Conscious when help arrived, but confused.
Ow.
And excruciating pain in his lower legs, but no feeling in his feet.
So, like, right away, something is really wrong here. Beyond just being trapped, obviously.
Yeah, big red flag for sure.
What were the first responders dealing with when they actually got to him?
Okay, so they found a 45-year-old male,
Okay.
conscious but disoriented,
Mm-hmm.
strong radial pulse, and normal breathing.
Okay.
His skin looked okay where they could see it,
Right.
but obviously his legs were pinned.
Yeah.
So a full assessment wasn't possible yet.
The source material mentions he had a whole list of medications that he takes regularly.
Yeah.
Does that complicate things at this stage?
It definitely adds another layer to consider. So he was on aspirin,
Okay.
probably for pain or heart health, Synthroid for hypothyroidism,
Mm.
2 antidepressants, fluoxetine and amitriptyline,
Wow, that's a lot.
and Tylenol 3, another pain medication.
Wow.
Knowing all this helps the medical team anticipate, potential drug interactions and adjust treatment accordingly.
Right.
Like, for example, aspirin could increase his risk of bleeding, which is obviously a major concern with any injury.
It's like they're playing medical chess,
Yeah.
trying to anticipate like several moves ahead.
Exactly.
What else did they find once they were actually able to get a better look at him?
Well, once they got the wall off of him,
Yeah.
it was clear his legs took the brunt of the force.
Oh, yeah.
The report notes more swelling in his right hand than his left.
Interesting.
It's hard to say for sure without more information,
Right.
but it could mean his right hand was either more directly compressed
Okay.
or positioned in a way that cut off blood flow more severely.
Okay, so we've got the initial scene, the medications, the crush injury to his legs. Where do they go from here?
So they did a full assessment once they could,
Yeah.
checking his head, neck, chest, abdomen, back,
Yeah.
all of which were unremarkable.
Okay.
His upper extremities were stable, but of course, they still couldn't fully assess his lower limbs.
And I'm guessing his vitals become even more important at this point,
Absolutely.
since they can't see everything that's going on.
Exactly.
Yeah.
His blood pressure was 127/86,
Mhm.
pulse 60, and regular respirations, 14 pupils, equal and reactive to light.
Okay.
Blood sugar was a bit high at 146,
Mm.
but that's not uncommon in a stressful situation like this.
Yeah, makes sense.
Oxygen saturation was excellent at 98%, and his skin was warm and dry, indicating decent circulation for the moment.
Okay.
But the real concern is the potential for internal bleeding
Right.
and the effects of that prolonged crushing force on his legs.
The report says he described the pain in his legs as quote-unquote crushing,
Yeah.
which sadly makes sense. He also reported numbness, but couldn't rate the pain on a scale, which,
Is understandable given what he just went through.
Mhm.
What's striking is that he'd been enduring this for an hour
Wow.
by the time they could assess him. An hour.
That's a long time
Yeah,
to be in that kind of pain.
I can't even imagine.
And it really underscores the urgency of the situation.
Right.
This brings us to the diagnosis of compartment syndrome.
Okay.
Have you ever heard of that?
I've heard the term, but to be honest, I wouldn't be able to explain it to anyone.
Yeah,
I bet a lot of our listeners are in the same boat.
probably.
Break it down for us. What exactly is going on here?
Okay, so imagine your muscles are all bundled up in these tough, fibrous casings
Okay.
called fascia.
Okay.
Almost like each muscle group has its own little compartment
Hmm.
when there's an injury, like a crush injury in this case. It can cause bleeding and swelling inside these compartments.
So the pressure builds up like a
Eh.
balloon that's about to burst.
Exactly. And that increased pressure starts to restrict blood flow to the muscles and nerves trapped inside.
Oh, that's what causes the intense pain numbness. And if it's not treated, eventually tissue damage.
So in our patient's case, the crushing weight of that wall triggered this whole chain reaction in his legs.
That's the most likely scenario.
Okay.
Yeah. The prolonged pressure and the trauma itself could have led to bleeding and swelling in his lower leg compartments,
Okay.
setting off the compartment syndrome.
What are the telltale signs,
Okay.
aside from the pain and numbness he was already experiencing?
So one major red flag is pain. That's way worse than what you'd expect from the visible injury.
Okay.
You also look for numbness or tingling, weakness in the affected limb, swelling and tightness in the compartment, and weakened pulses.
So our patient was already showing several of these. And how quickly can this become a serious problem?
Compartment syndrome can progress rapidly, sometimes within hours.
Oh, wow.
That's why immediate action is crucial.
Yeah.
Luckily, in this case, they were able to lift the wall and free him after about 25 minutes.
Okay.
But that's just the first step in a long road to recovery.
So freeing him from the wall is just the beginning.
Yeah.
This is where it gets really interesting, right? What happens next?
You're right. It does get interesting. Freeing him was critical, obviously.
Right.
But the real work begins once he's out from under that wall.
Right. So what were the immediate next steps? The source material mentions they got him on a backboard, rushed him to the hospital?
Exactly. The backboard's standard procedure
Mhm.
for, potential spinal injuries.
Right.
And getting him to the hospital quickly is crucial.
Of course.
During transport, they likely started 5V fluids to counteract shock and keep his blood pressure stable.
Okay.
That's especially important with crush injuries because of the potential for widespread tissue damage and fluid loss.
Okay, so they're stabilizing him. But what about treating the compartment syndrome itself? Is that something they can address right there in the ambulance?
Not quite. Managing compartment syndrome often requires a surgical procedure
Okay.
called a fasciotomy.
Fasciotomy.
Yeah, sounds intimidating.
It does.
But it's basically a way to relieve the dangerous pressure building up in those muscle compartments.
Okay.
The surgeon makes incisions in the fascia, those tough casings around the muscles,
Right.
to allow the tissues to swell outward instead of being constricted.
Got it.
It's like giving them space to breathe.
I see. So it's not just about getting the weight off his legs. It's about addressing the internal pressure that's already built up. Is a fasciotomy always necessary?
It depends on the severity.
Okay.
In milder cases, they might try less invasive approaches first,
Okay.
like elevation and pain management.
Right.
But in a situation like this,
Mm-hmm.
where there's been prolonged compression and clear signs of compromised blood flow,
Yeah.
a fasciotomy is often the best way to save the limb.
Makes sense.
Remember, time is muscle when it comes to compartment syndrome.
Oh, wow.
The longer those tissues are deprived of oxygen, the greater the risk of permanent damage.
Speaking of time, the source material mentions something kind of interesting about using a tourniquet if they couldn't do a fluid bolus. Why would they do that? Right.
It seems counterintuitive to cut off blood flow even more.
It does seem counterintuitive, but there's a good reason for it.
Okay.
If they can't give IV fluids to support his circulation, a tourniquet applied before releasing the pressure from his legs can actually help prevent something called reperfusion injury.
Reperfusion injury.
What's that? Think of it this way. When blood flow is suddenly restored to tissues that have been starved of oxygen for a while,
Yeah.
it can be like a shock to the system.
Okay.
It causes this rush of harmful substances that actually further damage the tissues.
Wow.
The tourniquet helps control that rush of blood, minimizing the potential harm until his body can handle it.
That's fascinating. It's like a delicate balancing act, trying to restore blood flow, but not too quickly.
Yeah.
It really highlights how complex these situations can be. The source material keeps mentioning acute traumatic ischemia,
Right.
or ATI. What is that exactly, and how does it relate to all of this?
You're right to bring that up. It's important to remember that the focus should always be on the underlying injury.
Which in this case is the crush injury itself.
Right.
Compartment syndrome is a consequence of that.
Okay.
ATI refers to the severe lack of blood flow to the tissues
Okay.
caused by that crushing force.
It's the root of the problem. And treating the compartment syndrome is part of managing the overall ATI.
So it's like treating both the cause and the effect.
Exactly.
You need to address both to have the best chance of a positive outcome.
Exactly. And another piece of the puzzle here is his ECG,
Okay.
which showed a junctional escape rhythm.
Okay, you lost me there. Junctional what now?
Think of it like the heart's backup pacemaker kicking in,
Okay.
because the regular rhythm is disrupted.
Okay.
It can be caused by various things,
Right.
including medications and trauma.
Okay.
In his case, it's not necessarily a crisis in itself, but it does need to be carefully monitored, especially given all the medications he's on.
Right. Let's circle back to those medications for a minute.
Yeah.
He was on aspirin, synthroid, fluoxetine, amitriptyline, and Tylenol 3. How might those affect his treatment and recovery? It's a bit of a juggling act.
Yeah.
Some medications might need to be adjusted or temporarily stopped, while others are essential for his overall health.
Right.
We already mentioned the aspirin and its potential to increase bleeding. The antidepressants, fluoxetine and amitriptyline, can interact with certain pain medications.
Yeah.
So the medical team has to be very careful there.
Of course.
And the synthroid, for his hypothyroidism will need to be continued to manage that condition effectively.
So on top of everything else,
Yeah.
managing his medications is another layer of complexity in this whole medical mystery.
Absolutely. It's like a puzzle where each piece has to fit just right.
Yeah.
They have to weigh the benefits and risks of each medication in his current situation
Right.
and make adjustments as needed. This is where a deep understanding of his medical history and how different drugs interact becomes really crucial.
It's incredible how a seemingly straightforward injury,
Right.
like being trapped under a wall, can snowball into such a complex medical situation.
Yeah, it is.
What are some of the key takeaways for our listeners so far? What are the aha moments that we should all be paying attention to?
Well, for me, it's a stark reminder of how crucial early recognition is
Right.
and timely intervention when it comes to compartment syndrome. The sooner it's addressed, the better the chances of a positive outcome.
Absolutely.
If it's left untreated,
Yeah.
it can have devastating consequences,
Yeah.
leading to permanent muscle damage, nerve damage,
Yeah.
and even amputation in severe cases.
This case also really highlights the incredible skill
Oh, yeah,
and quick thinking of the first responders and the medical team.
for sure.
They recognized the potential seriousness of the situation right away, acted quickly to stabilize him and get him the care he needed.
Yeah, their actions likely played a huge role in preventing further complications
Right.
and improving his chances of a full recovery.
I completely agree. Their coordinated efforts and expertise were essential in this case. It underscores the importance of having well-trained professionals who can assess, stabilize, and transport patients effectively in these kinds of emergency situations.
Absolutely.
And it emphasizes the need for continuous medical education,
Yeah.
staying up to date on best practices. The medical field is constantly evolving. There's
Yeah.
always something new to learn.
Exactly.
You've definitely given us a lot to think about today.
That has been interesting.
We've learned about compartment syndrome, crush injuries, and the intricate world of emergency medical care.
It's been a pleasure unraveling this case with you.
Yeah.
I always find it fascinating to explore these real-world scenarios
Yeah, me too.
and discover the hidden lessons they hold.
Absolutely.
It's a reminder that we can all benefit from expanding our knowledge of medical conditions,
Right.
even if we're not healthcare professionals ourselves.
Absolutely. You never know when that knowledge might come in handy,
Right.
whether for ourselves or for someone we care about. It's about being empowered to make informed decisions and advocate for our own health and well-being.
Speaking of advocating for our well-being,
Yeah.
this case brings up a point that we haven't touched on yet.
Okay.
We've discussed the physical impact of compartment syndrome, but what about the psychological effects? Imagine the trauma of being trapped, the fear, the intense pain.
Right.
How might that impact someone's recovery, both physically and emotionally?
That's a really important point. It highlights the need for a holistic approach to healthcare.
Absolutely.
We can't just focus on the physical injuries. We need to consider the emotional and psychological well-being of the patient as well.
Right.
True healing involves the mind, body, and spirit.
Well said. It's been a fascinating deep dive, and I hope our listeners found it as insightful as I have.
Until next time, stay curious and take care.